going to talk sports medicine right now. My good friend, Dr. Joe Congini, part of this morning show for over 30 years, on board with us again this morning. And Dr. Joe, good morning. What do you have on your list for us today?
Good morning, Ray. Unfortunately, a serious topic, but yours is the most knowledgeable sports medicine group that I know anywhere in the country. So I think we have to go here. And never before with you have I gone to the fourth one of these. So I'm going to talk this morning about sudden death in athletes again. And we've talked about that a fair bit, especially lately, unfortunately, in the last couple of years. We've had some local kids who have been off at other schools and things who have had sudden death. And the reason that I talk about these is these four things are preventable. And as long as the trainers, the strength coaches, the parents are aware of this, we can prevent all of these sudden cases of sudden cardiac death if we pick them up soon enough. And there's one more that's occurred that's a big controversy going on in the country right now of sports medicine. We know about the cardiac cases. We've had a couple local ones in the last couple of years. The heart problems, the cardiomyopathies, there's about 50 to 70 a year, we typically say in my career, but there have been a couple of years, maybe 100 in a year of sudden death from heart problems. And we know that we have now for the last 20 years or so, try to get AEDs everywhere we can, try to get AEDs as quickly as we can to the side of the athletes, and we can get these turned around. And that's I talk to people when I give this talk about the 4 H's. And the 1 H that's at the top of the list numbers-wise is heart. Number 2 is heat. And you and I, since the beginning of time of us together, in late July or August, always have one session on heat because it's preventable, but people still die from heat. 60 deaths in this country in the last 25 years or so. So it's not as big a number as cardiac deaths, but heat is the second H. Heart, heat. The third one is head. And we're not talking concussions, but we're talking about brain bleeds or second impact syndrome. They look different than concussions. These people are definitely out of it. We need to call an ambulance and get them to the hospital as soon as possible. And there are still about 15 deaths a year from brain injuries, not beyond concussion, the brain bleeds and the second impact syndrome. But the fourth one I've almost never talked about with you, and it's kind of because it's complicated and doesn't have as high a number. It's called, I use the H of hemoglobin when we give these talks nationally. We talk about heart, head, heat, and hemoglobin. Hemoglobin, what is he talking about? Hemoglobin is a thing. Many people have a thing called sickle cell trait, and it has really no medical problems as long as sickle cell anemia can be a lot of big problems, lifelong issues and medical issues. But sickle cell trait means that you just carry the trait, but about 30 years ago, we started to see that some of the people that have sickle cell trait, in very rare situations when they're exercising maximal exertion exercise in the heat and they're dehydrated, they collapse. And it's a different kind of collapse. These muscles, they go into spasm, but it's not the typical real hard muscle cramps. It's kind of a mushy, and they just kind of collapse to the ground. And these people, what happens, the red blood cells that are typically round and go through the bloodstream, what happens in these conditions, they flatten out and they harden and they block the smaller blood vessels, and these people totally collapse. And there's a case going on about this right now that's bringing up a lot of discussion, and it's treated totally different. Many people, when you see it, you think it must be a heart problem, and they go run for the AED, but the AED is not going to save this athlete. And if these people are left in this condition of collapse long enough, they'll start to break down muscle. We call that rhabdomyolysis. They start to break down their kidneys, and they die. And unfortunately, I believe in your part of the world at another time, in Pennsylvania, there's a case going on right now at Bucknell of an 18-year-old who died of sickle trait, and unfortunately it's a case of wrongful death. And a lot of sports medicine people are watching this case very carefully, because it's really, obviously, it's easy to say, Joe, like yours, but it's not as easy to differentiate these things. And I'm talking about it today so that people can differentiate. They look different than the cardiac ones where we're using the AEDs to restart the heart. These people they're kind of in a heap on the ground in a collapsed situation. And the things that bring them back are certainly, many of them are dehydrated, which cause these red blood cells to flatten down and block the very important small arteries. But the most important thing is getting oxygen to them as soon as possible. So many people don't have oxygen. Some colleges do. But if they don't have oxygen readily available, you have to get a unit, a squad there as soon as possible. And instead of pulling out the AED first, the high-flow oxygen and oxygen masks get these red blood cells to go back to their normal shape, to get rid of these big cramps that they're having, and that will lead later to muscle breakdown and kidney breakdown. And they're life-saving to just get oxygen on them and to hydrate them. And it's called sickle cell trait. Many of the studies on these, Ray, instead of being in athletes, were done about 30, 20 years ago. Good friend of mine by the name of Frank O'Connor. Frank came to Akron for me a couple years ago to help me with a heat case. He is they call him the godfather of military medicine. And because we're training so many of our military warfighters to fight in such hot and humid zones, people die from sickle trait in the military more often even than they do in the sports arena. And Dr. O'Connor has spent his career making sure that people are aware of how we turn these cases around in the military as well as in sports medicine. But this case at Becknell is really going on right now and with wrongful death. The other complication that came up with these cases, Ray, back early in my career was, well, do you tell everybody who has sickle cell trait they can't play sports? Do you know how many people that we would be telling they could never play sports again? No, it's not restricted from playing sports, but they just need special accommodations in their workouts, and they can't get to that maximal exertion. They can't get to that where they're really hot and dehydrated and the heat gets going. And if they start at all to be feeling any of this cramping, they need to stop immediately. But they are not restricted from playing sports. They can play sports. We just have to be aware of the fourth H that can cause preventable sudden death. And remember them again: heart, heat, head, and now you understand hemoglobin. And if they sickle, these red blood cells sickle, we're starting into trouble. Get O2 on them, call a squad, and get oxygen going as soon as possible.
Well done. Great education, Joe, and perfect timing, too, of what we're heading into with a busy outdoor high heat season. Well put together. Joe, my friend, great job again. We'll do it again next week. Thank you.
Sounds good, Ray. Have a great week.
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, part of this morning show for over 30 years. He's always got great sports medicine insight and education.